Hey, welcome back, you guys. We are continuing our party on the plaza this morning, and one of the important areas that I wanted to focus on was hair loss. It was a conversation that continued to come up as we were talking about National Hair Day, and I have Dr. Sam Lamb, the man you call when you want to talk about this subject, has so much expertise to offer us this morning. Dr. Lamb, I want to focus first on just hair loss in general, right? I want to start off with discussing it in women. We talked about black women and some of the things that they have to deal with. So give me an overall overview of what's important when it comes to hair loss.
So first of all, it's very common in women. 30% of women over the age of 30 lose hair. So that's something that people always feel very isolated. Women feel isolated. They think this is not normal for me. But it is actually something that's actually quite common. The second thing to understand is that about 40% of my practice is actually women when I'm doing hair transplants for them. But African Americans in particular have a certain disease where they're having traction hair loss, where hairs are pulled too tightly and they lose this. And actually I perform one of those almost every other week. So that's a huge component. But one thing is important with African Americans that lose hair here is there's a scarring condition called CCCA, which is too long to expand upon. But the concept is we have to have a surgeon that actually knows when to operate and when not to operate on someone.
One of the issues that I've noticed too, pregnant women, after they've delivered a baby, what's happening internally with them when it comes to losing hair?
Yeah, my wife was pregnant just recently and she was going through the same process right now afterwards. So what's happening is that the estrogen is holding all the hairs in what's called anagen growth phase. So once that estrogen gets released at the time of birth, then the hairs start to shed. And the nice thing with that is that it does reverse itself.
And you mentioned something to me. Of course, we talk a lot about the hair growing out of your scalp, but you also mentioned eyebrows. What is happening with that?
Well, you know, there's been a huge trend toward larger eyebrows or thicker eyebrows. In the past, there was a huge trend toward over-plucking. So a large part of my practice is actually eyebrow restoration. So just making the eyebrows look beautiful and thick again. Sometimes other conditions like hypothyroidism, besides over-plucking, can cause that. And there's also unusual conditions like FFA, which we can talk about as well, scarring hair losses, that we have to make sure that we're actually operating on the right patient. As a surgeon and as the president of the American Board of Hair Restoration Surgery, the key thing is to operate on safe patients and not be fooled by conditions that are not safe for surgery.
Okay, Dr. Sam Lamb, I know he has a whole lot more to offer you guys. I'm going to try to make sure we can get like an Instagram Live or a Facebook Live later on, because I know Dr. Lamb has a lot more to tell us about. Thank you so much for joining us here this morning.
Thank you so much.